Hi, everybody.
Hi, Imrana.
Hi, Aparna.
Hi.
Hi, everyone.
Hi, everyone.
Hi, hi.
Hi.
I'll just give it a minute or so and then I think Nadine will want to start. Hi, Arpana.
Bhupindu, have you got the camera from BBC? You look so big on the screen.
Because I'm holding my phone.
Okay. Because it looks like you are from the BBC.
You got a full like camera crew in there, have you, Bhupinder?
No, it's like a passport mugshot, isn't it? Like you go when you go to jail.
Just about 40 now, Nadeem. I don't know if you wanted to.
Can we just start then?
Yeah.
Okay, hi everyone. Welcome to the NHC webinar. Maggie, can we get the agenda up, please? Just a quick reminder, if you can just please mute if you're not speaking. For the agenda items, put your hand up and we'll come around to you. Arpan, are you around to keep an eye on the chat bar today? Okay, Arpana?
Yeah, that's fine, Nadine.
Okay, so just going to start with next slide, please. Sorry. Really sad news last few weeks. One of our colleagues, Dr. Rao, who was a GP for many decades at Glen Road, which is just near Newham Hospital, passed away. He's also the husband of Dr. Sudha Madipali, one of our colleagues. So I just want to hand over to Dr. Sabir Sen, who's just going to say a few words, and others, I'm happy for anyone else to contribute as well. Sabir?
Thank you. Can you hear me? Thank you. I think I was expecting Sudha to join, though she was not really very good from this morning either. So she will try to join for half an hour because she's got another appointment at 1 o'clock. So as if everybody knows, with the great sadness, we have to say that we have lost one of our colleagues who was a very silent GP in Newham. He provided everything for the patient silently. You know, me, Nadim, all of us who talks too much. There is some doctors who never talk. He just carried on their duties and give their life for the patient population and contribute to general practice. We never talk to them. There's a lot of GP like this in Newham still around. We only talk to them when we lose them. So today we are going to celebrate Dr. Rao's all the contributions and dedication for the general practice. I just wanted to go through his life story. I went to meet his wife, Dr. Madipali, who is also our colleague, on Thursday. She's not in a good state either, but I spoke to her this morning. She said she will try to join us if she can, and we'll see whether she come in. Just let us know if she's here. So Dr. Madipali is Dr. Rao, Visnath Rao was a Newham GP, a long-standing quiet GP. I'm just going to through his lifestyle to say that how this Southeast Asian GP hardship in this country after come to this country and raise a practice and work silently and get the patient care going without thinking about their life. These are the silent player we always had. We only knows about the GP through the Daily Mail when something goes wrong. We never talked about this GP. We never appreciated unless something happens to the life. And we all feel sorry when they're alive. We don't never appreciate. So I just wanted to celebrate the success of Dr. Rao has contributed to the Newham. So he was born in 1947 in a town called Rajamundry in Andhra Pradesh in India. And like many of us, he came from a village background where from a villagers. He was the 11th child of in the family. And Dr. Rao showed always his resiliency. That time, if you develop smallpox, that means it's very difficult to survive. But our hero still survived in the childhood. He fight the chickenpox and he came out it and he proved he's resilient. So after 17, he finished school and it's very unlikely to get a chance in both engineering in medical at the time until you were extremely bright. Dr. Rao has proved from the childhood that he was a very bright, so he succeeded to get a position in medicine and engineering, but he decided to become a doctor, and fortunately, and he just made the whole family pride because he's the first doctor in the family. So the parents was very happy with the brightness of their son, who is our Dr. Venkat Rao. So after 75, he was in India. Then he decided to come to UK. So he came to UK and then he decided to do a bit of orthopedics and anesthesia in 1978 when he decided to become a GP. So he joined in Leighton with a Dr. Lewis, who was his trainer there, where he spent 1 year. So once he finished his training in 1980, then he decided, hang on, I need help. And like behind every successful man, there is a woman. So he found out his little princess, which our colleague Sudha Madipalli. He got married with Dr. Madipalli, and then after 6 years of marriage, they have a son, Srinivas. I will show you his pictures later on. So once Sudha joined, then Dr. Madipalli has really doubled up his energy level. So then they started to develop their own general practice. So then they decided to really go and find a way to set up their general practice. So that time in 1985, he joined Dr. Gilbert, whose practice was Newham, where we all know is near the Newham General Hospital, and who worked initially in general practice. But that time also there is a premises issue. It's not new. General practice always has this premises issue, 2 sites, 1 site. So then the system has changed and it was very difficult to operate from the 2 premises, both from the health authority side and also the general GP side. So he wanted to build up with Sudha's energy a new building that is only few at that time available, called state-of-art purpose-built general practice. And Dr. Madipalli was proud to build one of them, and he really represent Newham that we are really very early adopter. We know the things, how to move forward. So then he, at the same time, there's 2 surgery closed, and then they're all confined to this little building. You can see in front of you, the building is there, but the founder is not there. This is the sadness of the general practice. The building, the bricks will remember Dr. Rao, his hard work, how he's giving sweats and blood to build up this the general practice. So he continued very work hard with Sudha's help, and there was not really any patient. See, they started their general practice with 0 patient. Let's see now. Right, okay. So once Dr. Madipalli started practice in 1991, Sudha completed all her training from Whiskers Hospital in ophthalmology, and she bring a new expertise in the practice. So she started to practice a bit of ophthalmology. She really gave a lot of support to Dr. Madipalli. One thing we did not know, I didn't know before the Thursday when Sudha told me, Dr. Madipalli did not go for any courses, did not go for any career development. Only things he did, supported Sudha to build up her career. This is the generosity of that man make us proud to feel like that it's not all about me. It's about the surroundings I'm living with. So he gave all his energy in the general practice, and he let go Sudha to do all her career. And that was makes him really a man to remember and to appreciate the dedication he did for his family and the general practice. So he served general practice in Newham population, not only general practice, they did minor surgery, they did ophthalmology, family planning, all these services that patient needs, they provided together. Now, Dr. Madipali used to leave the home at 8 o'clock in the morning to 8 to 8:30. He left the surgery between 10 to 11. I cannot remember in my career I ever left that late. That was his daily life. He was there for patient, paperwork, everything. So, you know, the new generation GP, we have a different kind of general practice. These are the people who take the profession and the life together. So after 11 o'clock, if you go home, what left? Again, 8 o'clock in the surgery. So these are called hardcore general practitioners. There's a lot of learn from them. Their dedication should encourage us to move forward and think about more personalized patient care. So he was not only a GP, he also helped a lot of our colleagues doing their appraisal, giving them positive feedback, catching them up when somebody need help. So he was, as an appraiser, he also appraised Newham GPs. He was also an LMC member, and he also talked about GP issues. I think Greg is here. I don't know whether he can say something about Dr. Madipali. He was a very active member of LMC, and he participated all the debate that matters to GP's life. So Dr. Madipali continued during his pandemic from the home, but he died of something else. And at the age of 74, we have lost this colleague. And that's why we're just remembering all his dedications. So with that note, on the behalf of all GP community of Newham, the practice staff, management team, Newham Health Collaborative would like to convey our deepest condolence and sympathy to Dr. Madipali and Srivas. And we wanted to really make sure that Sudha, you come back as usual to general practice. We are here to support you. You take your time. We pay respect to Dr. Rao, to supporting you. Whatever you need, you just tell us. This is not the time to think about the practice. Take time as much as needed. Our colleague Bhupinder Kohli, I know that he's brought in his hand and giving the all support you need. I really wanted to Bhupinder to beside Sudha when she needs him most. So with that note, I wanted to really give my all sincerity condolence to the family, and I hope that Sudha will be able to come back to general practice and give the service she wanted to give to her practice population. Thank you. I think if anybody wanted to join, please say a few words about Dr. Rao.
Thank you. So a really, really nice and touching tribute from you. And like you said, condolences to Sudha and the practice, and also their son Srinivas. Sounds like a really interesting and great life he actually led. So if there's anything we can do, then I'm sure we will do as a primary care community. And I don't know, I know you knew the family quite well as well. I don't know if you want to say a few words.
Yeah, I'd just like to, I would like to say something, if that's all right. So I first met Dr. Rao about 10 years ago when I first started, and I actually still remember the very first time I met him. It was in a Friday meeting. He quietly came and sat down next to me, and then at the end of the meeting, he introduced himself and asked, just asked about me, asked me where I'd studied medicine, where I'd done my GP training, what I wanted to specialize in. And I still remember now that he actually gave me, said to me, this is my number, call me if you need anything, if you need me to help, if if there's anything that Sudha or I can do for you, just give me a call. And I remember at that time thinking, what a nice man. And I was quite touched that he was genuinely trying to offer me his help. And I think that's how I will remember him. And I would still describe him in that way. He was a genuine man. He was really hardworking. He was an honest man and he had great integrity, and he was really well respected by all of his patients and all of us colleagues as well. He dedicated so much of his life caring for his patients, and he was always doing, things for his patients and colleagues happily. So he'd always go out of his way, always go that extra mile to help patients and support his colleagues as well. So I think, Dr. Sen, you mentioned about the younger generation. I agree, we can all learn so much from him. His work ethic, his honesty, his integrity, and his consideration for others. He dedicated his life to medicine, to general practice, to his work and to his patients, and he was working day and night, but he was always jolly and always smiling. And for me, that's how I'm always going to remember him.
Thank you, Arpana. Bhupinder, I know you've been working quite actively recently in supporting the practice and through the.
Thank you so much for Sabir for putting that conversation together. That's really helpful. I've worked in Newham since 1989, and I remember seeing Glen Roan surgery when it was built, thinking, my God, I wonder who did that, because it was the brand newest, loveliest building in Newham. The only other nice purpose-built building at the time was Lord Lister Health Centre. It was just really an extraordinary achievement for Venkat to have achieved that dream, to build a state-of-the-art building. And 33 years later, it's still a testimonial to his work, because the legacy is that it's one of the most important hubs in Newham. But it's still used every day, every weekend, and Venkat only ever worked. It's what I remember him as. He worked, he came to every meeting, he asked the most intelligent questions. He would sit in the front and he would always challenge the speakers, and I would love his questions because they were always appropriate, always had the courage to speak out. You couldn't fool Venkat, and that's why he was adorable and difficult. But he was absolutely the kind of guy that the NHS has made of. Asian doctors have come over, first generation have worked. And Sudha says, Bhupinder, all we did was work. We would go to work in the morning, come home at 10, 11 at night. All we did was work. So it's a great loss. And I feel sorry that he didn't get to retire, because he was still working before his first holiday in about 6 years that he'd had. And sadly he didn't make it home. But yeah, I'm sorry, my apologies.
Thank you, Bhupinder.
Thank you.
Thank you, Bhupinder. I can see how hard it is for you, and I can see Sudha's on the call as well. So I think it's really important that we appreciate locally what all of our kind of colleagues and predecessors have done, and also in the NHS, all of the first generation doctors and the hard work they put in, that we don't even come close to, actually, especially from the subcontinent. And so they're really, really sorry about your loss, and Srinath, and any help we can give in NHC, we'd be more than happy for anyone else to just come on and say a few words.
Sudha, everybody, we just wanted to pass on our condolences to you and the family. Dr. Rao, like Bhupinder said, always front of the lecture theatre at Newham. Absolutely intelligent questions, like Bhupinder has said. It's a sad loss to the Newham community and further afield. And as Nadim has said, anything that we can do to support or help, we are all here for you, and wish you well.
So I know it's a really hard time for you and the family, but if there's anything you would like to add, but we understand it's quite difficult as well at this time.
Thank you, everybody, for all the kind words. We all miss him. Thank you.
Okay. So hard time for us locally. I don't know if you want to just say a few words, Karen.
I guess is just to echo the support of the GP community and say, you know, very strongly that, you know, we want to support you and the family to have the space you need. And, you know, if there is anything, I know colleagues on the call want to be as helpful as they possibly can be. So please draw on it and just ask and take the time that you need as a family to just have some space.
And we'll be reaching out proactively to you in your practice anyway, you know, hopefully next week, to see how we can kind of help to support you.
Thank you.
And that's should we move on to the next agenda item, Imrana? Got Imrana and Dr. Rasmus, and also I can see Monton and Daniela are here to give us an update on psychological therapies. Is that okay, Imrana?
Yeah, thank you, Nadeem. And again, thank you, Sabir and others for, you know, such a, you know, touching celebration and inspiring one about Dr. Rowe's life. And again, to Dr. Sudha as well, that offer is universal from everyone in Newham. I didn't have the pleasure of knowing him, as well as obviously some of our other colleagues, but you know, he's touched all our lives and all our patients' lives. So I guess in some way it's difficult to follow this, but what we're going to talk about is in some ways also is an apt discussion. So I'm not sure if people are aware, but this week is Mental Health Awareness Week. And actually the theme of this week of this Mental Health Awareness Week is loneliness. And before I kind of hand over to my esteemed colleagues, I just thought I would reflect for a moment. And I guess it links in with what Sabir was saying, you know, the silent heroes that we work alongside, but we don't really interact with. So yesterday I attended a GP meeting face to face, I think, and we worked out it was the first face to face meeting outside the practice for over 2 years. And you know, a lot of people on this call were at that meeting: Nadeem, Sabir, Kavita, Lyra, and I'm sure a few others. And that feeling of actually being in the same place together, and you know, I hope Kavita won't mind, but she just ran over and hugged me. You know, so it's we underestimate the importance of it. So I know we talk about impact of loneliness and pandemic on patients, but actually it has a toll on us all. So it was just a little reminder, the importance of connecting with each other. So if I introduced what I was meant to introduce, was we wanted to just run through what the offers are in terms of psychological therapies in Newham. As a GP, often when we're kind of seeing patients with mental health issues, we think of we refer to psychological therapies. I think every clinic we have somebody refer to psychological therapies, but often sometimes it can feel like we're referring to kind of a homogenous you know offer. But actually what psychological services in Newham offer is such a huge range of interventions. And if you kind of compare it to you thinking of psychological therapy as medication, in the sense that it's not one medicine you give to patients, there's a whole range of things. And so I really I do have the pleasure of kind of doing this in two parts. So one is the first part, I would introduce Daniela and Monton, who are our clinical leads in Newham and also in Tower Hamlets for our Newham talking therapies. And they're going to give us a whistle-stop tour of the offers that they have within the Newham Talking Therapies, and also some of the really amazing work they've been doing in terms of tackling inequality within Newham. And then after that, we'll hand over to Erasmo, who will talk us through some of the psychological therapies in secondary care. So I'll hand over without further ado to Daniela and Monton.
Imran and Karen, thank you very much for giving us an opportunity to come and talk to GP colleagues today. I'm sorry, I'm really moved by the privilege of being part of Dr. Rao celebration. And for us, Newham Talking Therapies, and Erasmus probably I'm sure you agree that we feel privileged to be able to serve population of Newham, picking up the dedication and the inspiring Dr. Lau legacy has left us. With Newham Talking Therapies, we are very proud that in the last 12 months we have seen 14,000 referrals coming to our door. And really again, Newham Talking Therapy under Daniela's leadership. So I think it's much more around working with our GP colleagues to continue to do the best, that we can for the population of Newham. We would love to Daniela has prepared a presentation to talk us through about what Newham Talking Therapy is offering, and then again we would love to get feedback, any question that you might have. Daniela, is that all right to pick up?
Yeah, lovely. Thank you so much, Monton. Thank you so much for having us here. Maggie, can I check if you're okay too? Oh, brilliant. Thank you. So we are your IAP service in Newham, which means that we work with common mental health difficulties like depression and anxiety, but we also see a lot of trauma in Newham. And in the last maybe 5 years, we really embraced this population health approach where we work to improve the physical and mental health of our community. And that means we work with people presenting with long-term health conditions, but also we worked a lot with people recovering from stresses around the pandemic, social isolation, as Imran was saying. Recently, we've started to work with mild to moderate eating difficulties, so we're currently expanding in the gap. So in terms of our provision, we use a stepped care model. So as Monton has mentioned, we've seen a little under 15,000 referrals in the last 12 months, and most of our referrals come from self-referrals. And as GPs, obviously, you have your conversations. We do encourage you to continue to ask people to self-refer to us. They can do this online or by calling us. And we noticed that about 80% of service users who come to us are actually self-referrals. And we know with psychological therapies, the more motivated you are to seek treatment and to get support, the more likely you are to have a good outcome by the end of the therapy. And also in terms of our composition of our service users, about 80% of them identify as PAME, which is great for our population profile. So in terms of the model, we get the referrals from everyone, especially self-referrals, and we process the referral within 24 hours. That means the patient gets a phone call and they are booked to triage, which is the initial assessment, within 3 to 5 days. So we're really looking at a fast assessment process. During the assessment process, we look at the presenting need. Are there any complicated factors like social and economical difficulties? Then we look at, are they presenting with common mental health difficulties or severe mental illness? So we can signpost at that stage of assessment. We're embracing the no wrong door approach. So if someone ends with us, we will make sure they access the right service from the beginning. So that means we refer to our colleagues in secondary care. Erasmo is going to speak a lot about the developments there, but also we do a lot of signposting to community organizations, and we work very closely with the London Borough of Newham in responding to the refugee crisis and everything that we have seen over the last year. So following the assessment, if they are presenting with common mental health difficulties, we then refer to one of our interventions, and we really use packages of care. As Imrana was saying, we don't offer kind of something to the same thing to everyone. We look at the presenting need, we look at the intensity of the treatment they need to access, and we use the step care model. So at step 2, you've seen all the icons there. We offer online therapy. In the last 2 years, our service users have really surprised us in terms of their resilience and their ability to make use of remote therapy, because we did not close during the pandemic. We switched to online therapy within a week of the lockdown being declared. We enabled people to use technology. We did IT suites on site, so if people didn't have access to a phone with data or a computer or even confidential space at home, we would still be able to see them by enabling them to access these IT suites. And we're still seeing right now a lot of preference for remote therapy. So I think it's been more than a year. I think, actually May last year, we've been offering face-to-face interventions as a choice. So not as dictated by a need, but people could just opt in to be seen face-to-face again. And we're still seeing a lot of preference for remote therapy, but people gradually coming to see us on site. So we do remote therapy, digital therapy, face-to-face, and groups at step 2. And I'm gonna run through the interventions at step 2, but you're really looking at 6 to 8 sessions for people presenting with stress or first episodes of depression, or people who have been through therapy and they need a refresher. If the needs are more complex, then we're referring straight into step 3 interventions. And in Newham, we're very blessed to have a wide range of interventions, from CBT, which is the IAPT modality, but also we do relational therapies like dynamic interpersonal therapy, brief dynamic therapy, interpersonal therapy. So we don't just offer CBT. And again, it's online or face-to-face, one-to-one, or in groups. So I'm just going to take us through the options right now. So using the step care model means we work a lot on prevention. So we want to do an outreach that makes sense for our population. We've been working really closely with the LBN to be present during the pandemic, and we've been linked up with all the groups that were running. We supported the befriending service and so on, but we continue with the community outreach, mainly workshops and webinars. We also provide the self-help booklets. So if you're seeing someone in your practice and they're thinking about maybe coming to talking therapies, you can still ask them to come to us, and we can provide something as simple as a self-help booklet. Sometimes that's all people need. And we use a lot of computerized CBT. We do a review call in 3 months, for example. But if they want to be seen, then we do therapy groups. And I'm sure you're up to date with the new NICE guidance for depression. But group therapy for depression is the #1 choice that should be offered to patients. And we've noticed that when we review our recovery rates, people recover better in group therapy than in one-to-one therapy, because there's a wealth of support available to them by people who attend, who have gone through the same difficulties as they have. They learn they're not alone. They learn they have a lot to still give. So they feel empowered. They feel enabled to carry on with more day-to-day tasks. So if someone is coming to you with depression, please think of group therapy as the #1 recommendation from NICE. We, of course, still offer one-to-one, 6 to 8 sessions. We have reviews with the clients, and we step up if they need to. So our groups involve stress groups, depression groups, worry management, managing LTC, dealing with loneliness as well, perinatal groups for people in the perinatal period, but also partners. So we really respond to the needs of the populations, and we develop groups as needed. The waiting lists for groups are really low. So for example, depression groups start every week. So if you're referring someone to us, they get a triage within a week, and then they can start therapy the second week after you refer them to us, or they self-referred. Stress groups, again, every 2 weeks, because the demand is a bit low, surprisingly, right now. But we really respond to the demand, and we expand where we need to. For one-to-one guided self-help at step 2, the wait list is up to 5 weeks right now. So if you're referring someone, they get the triage, they will be seen for their one-to-one appointments within 5 weeks of assessment. And then we're looking at the step 3, which is the more intense interventions for people with more complicated difficulties. We have pre-therapy groups for people waiting to be seen in one-to-one and groups as well. So we have pre-therapy groups for trauma, for depression, for worry, for relational difficulties, where people learn to identify patterns in their relationships with children or with their partners. So these pre-therapy groups are 1 to 4 sessions online right now, just to help people develop coping skills as they're waiting. The therapy groups, again, they're 8 to 10 sessions. Again, the waiting list for group therapy at step 3 is really low. So we have 2 depression groups starting every month. We have anxiety groups for panic, GAD, so generalized anxiety disorder, OCD, PTSD, and we have at least 1 starting every month. Some of them starting every 3 weeks. So again, very low waiting list for group therapy. Again, recovery is surprisingly amazing, over 50% in our groups. And you know, the national target is 50%. And then for one-to-one, you're looking at IPT, so again, a treatment for depression, DEET, brief psychodynamic therapy, counseling for depression, couples therapy. And this is where the waiting lists increase. So at the moment, our highest waiting list is for one-to-one CBT, which is between 10 and 13 weeks. But looking at the recovery rates, we really recommend you to support the client thinking about everything that is available. Our triagers are very good at presenting the options. So unless they come with an expectation to be seen one-to-one, they will potentially explore all the options with us. For all of the relational therapy, so DEET, psychodynamic counseling for depression, the waiting list is lower, 3 to 6 weeks. So again, it's great news there. And then in terms of the partnership with Have With Mind, they can also access counseling. So the waiting list there at step 3 is 3 to 4 weeks. So it really varies, and we really do encourage you to think about kind of making use of everything available and encouraging them to come up with an open mind. We have videos explaining what to expect from group therapy, what to expect from one-to-one, and our website is really well equipped for that. Very briefly, since 2021, we've been really committed to looking at what our service does in terms of addressing inequalities in Newham. We've always been passionate about this, but the BABCP offered us a tool to actually do an internal audit against these 4 areas: improving access, adapting therapy, improving engagement with service users and communities, and workforce and staffing. So we've developed this team of service users and our therapists to actually conduct this audit in 2021, last year. And this really helped raise awareness of inequality issues, and it helped us with recommendations that we're now implementing. So in terms of positive areas of good practice, we realized that we're doing really well with kind of mapping the ethnicity of our service users against the borrower profile. As I mentioned, 80% of our service users identify as BME. We provide culturally sensitive interventions by using supervision, exploring areas of adaptations with individual service users, and we continue to work with interpreters. So we do one-to-one interpreting work, but if a client wants to come to a group intervention, we can have an interpreter assisting them. So we also develop groups in other languages, Bengali, Urdu, depending on the skills of our therapists really and the need. And also one of the areas of kind of good practice is that the clinical staff group actually reflects broadly the population we serve. And we've had a lot of input with our recruitment team to help us actually develop career pathways into psychology from the population. So we have PWP apprenticeships right now, where actually previous service users train up to become therapists, psychological well-being practitioners through the apprenticeship route. So we're really passionate about going back to the intent of IAPT. And then if we move on to the next slide, the 2 main areas we're focusing in terms of the recommendations from the audit is to actually ensure BME service users fare as well as white British service users in clinical outcomes, but also in level of satisfaction. So when we look at the recovery rates for our services as identifying as BME, we've noticed that some groups, most of the groups do better than white British population, but some groups are a bit lower on recovery rates. So we identified this using a QI project. We're looking at data, really. We want to make sure we understand what's happening. And then we're developing focus groups to look at the experiences of the service users and capturing this feedback to help us understand how can we improve the experience of our service users coming to